Hello viewers, Assalamu alaikum. I am Dr. Hashmod, Junior Consultant of Anesthesia, Department of Anesthesiology and Intensive Care in Monash Medical College Hospital. I want to talk about very important and short topics also, which is commonly used by anesthesiologist and in intensive care unit. This is called laryngeal mask airway, LMA. What is LMA? Laryngeal mask airway. This is a supraglottic airway device and designed in 1980 by Dr. R.C. Brain. It actually seal the laryngeal inlet and by positioning in the hypopharynx in such a way we can ventilate the patient. It helps in ventilation. These LMA, laryngeal mask airway, have three parts. In the previously or first generation LMA has three parts. One is airway tube. This is the main part of LMA. And the second part, this is the cushion. This is also called cushion, which fully seal the laryngeal inlet. This is called the mask or cuff. And for inflation of the cuff cushion, there is also an inflation line and pilot balloon also. How many classification of LMA? LMA mainly do two types of LMA. Previously, we have used, and in Bangladesh, we are usually used this type of LMA. This is the first generation LMA or classic LMA. And in advanced center and higher center, in many other countries have the advanced features LMA. This is called second generation LMA. The first generation LMA we usually used. This is the classic LMA, and we use usually for ventilation. Second generation LMA or LMA, it has some advanced features. It has some safety features, features also. If we give the example, this is LMA Flu Seal, LMA Soft Cream, iGel, LMA, this is etc. It has a special feature. This is gastric. It has gastric drain tube. In first generation LMA, no gastric drain tube. This is the extra and advantage of gastric second generation LMA is gastric drain tube, and it has also had seal pressure. Now, if we compare in a diagram of first generation and second generation LMA, we will see that in first generation there is no gastric drain tube. In second generation there is a gastric drain tube. This is the extra advantage of for the patient and also for the physician. When we use the LMA, we can perform the short procedure of anesthesia by using LMA in case of child. We usually use the LMA. But we have to in mind that patient must be as a grade 1 or 2, not in grade 3 or other problematic patient. We will not never use the LMA. And In case of failed intuition or difficulty in any emergency situation, also we can use LMA. And in modern guideline, in case of CPR, also use LMA. In some conditions or situations where never we will use LMA in what is absolute and relative. Absolute contraindication, or where we will never try to use the LMA. This is the situation uh, where is chance of aspiration in case of full stomach patient or morbid obese patient. If we use the LMA, there is a very much chance of gastric aspiration and aspiration pneumonia. Aspiration is which may be very fatal and dangerous and life-threatening condition for the patient. We will never use the LMA in this situation. And some other relative contraindication also, there's the unstable cervical spine. In case of unstable cervical spine, we first we will have to support the cervical spine, not to move further. Then we can use elbow, but very cautiously and skilled hand. In case of poor lung compliance, we will not use the elbow because we will not see the performance of the LMA, or we will not assume the ventilation is adequate or not. If any surgery is in the oropharynx or pharyngeal or in the mouth cavity, we will not use the LMA. That is very important for juniors and learners is insertion process of LMA. At first, we must have to prepare the patient, must have to prepare the instrument. Prepare the patient, that is, the patient must have to, in empty stomach, not in full stomach, and proper fasting condition is mandatory. And in case of equipment preparation, cuff integrate, we will check the cuff integrate, and we will use the lubricant to easy insertion of the LMA. And patient positioning is very much important because in proper positioning is not possible. There is a proper insertion of the LMA is not possible. And pre-oxygenation to prevent the hypoxia during the insertion time, and passes never we will passes the inflated cuffed LMA. We can insert partially or fully deflated cuffed LMA. And this is the standard technique, and we usually use for LMA insertion. At first, we hold the tube LMA like a pen, and then we will have to push the LMA against the heart plate, by following the curvature and behind the epiglottis, never in front of the epiglottis, because in front of if accidentally we insert the cuff in front of the epiglottis, then epiglottis can seal the laryngeal inlet, and there is a chance of obstruction of the laryngeal inlet. There is also another technique which is called rotational rotational technique also. In this case, we will follow the heart appellate and towards the hypopharynx, and after insert, when we feel the resistance, then we will rotate the LMA into 180 degree, which fully placed in the laryngeal inlet. Cuff will position it like laryngeal inlet, and when we inflate the cuff, then it fully seal the laryngeal inlet. This is the rotational technique. There are many different sizes of LMA according to the weight of the patient, and there is 7 types of LMA according to the weight of the patient. In case of less than 5 kg weight patient, we can use number 1, 5 to 10 kg, 1.5, and 10 to 20 kg, number 2, 20 to 30 kg, 2.5. And 30 to 50, number 3, 50 to 74, and 70 to 100. We can use the number 5. You can say that if the patient weight is more than 100, at first we talk about that more obese patient is better to avoid LMA. So up to 100 kg, we will use the LMA. In morbid obese patient, it is better to avoid the LMA, and different sizes of LMA and the cuff volume is also different. And we will inflate the cuff by in an inflation channel in according to the size, according to the volume of the cuff. There are some general complications which may occur in case of we use the LMA, and in some situations there may be more serious complications. We must have to manage immediately to save the life of the patient. The common complications, like if the inflation valve is not properly inflated or partially inflated, that is maybe leak, and it get involved. So throat heart compression. This is the common complication. Serious possible complication is in previous slide we have discussed about the aspiration. And then full stomach or morbid obese patient, if you use the LMA, that is more chance of aspiration. So we will have the preparation of the patient in proper fasting condition, and in if accidentally the vomiting or regurgitation occur, then we immediately suction of the patient, intubate the patient, and bronchoscopy and supportive care must. And there is a chance of laryngospasm. Actually, in case of laryngospasm, we will depend the patient, and positive pressure, ventilation, and proper oxygenation. Seriously, in case of accidentally, if the cuff is inserted in front of the epiglottis, then epiglottis can block the laryngeal inlet fully, and there was a chance of airway obstruction. We will have to check and recheck in this situation and manage accordingly. At the last, we say that the LM is a crucial modern tool for anesthesia, and thank you very much. And if you have any question, you can you please write in comment section. I will try to give the answer of your question. Thank you very much. I will say again.